Welcome to the deep dive. Today, we're going to be
Right.
looking at acute intracranial problems.
Okay.
We've got a medical learning guide here.
Awesome.
So we're going to try to unpack all that and figure out what it all means.
Sounds good.
What happens when things go wrong inside our skulls.
Right.
And I think it's going to be pretty interesting.
The brain is super interesting.
Okay.
It's, essential to everything we do. So yeah, it's really important to understand.
I remember that the guide starts by talking about ICP,
Okay.
intracranial pressure.
Right.
Can you explain just like what that is and why it's so important?
I think a good way to think about it is, picture your skull as like a rigid container, like a closed
Okay.
pressure cooker.
I see, yeah.
And you've got, your brain tissue.
Okay.
You've got blood flowing through there.
Yeah.
And then you got cerebrospinal fluid.
Right.
CSF.
Yeah.
And all of these things are super important for the brain to function properly.
Right.
But the key here is balance. They got to kind of coexist together in harmony
Makes sense.
within this fixed space.
Yeah.
So if the pressure inside the skull, gets too high, it can lead to some issues.
So speaking of CSF, I remember reading about this procedure, a lumbar puncture, like a spinal tap,
Oh, yeah.
where they take some of this fluid out.
Yes.
What is that all about? Why do they do that?
It's essentially a way to get like a sneak peek at what's going on in the central nervous system. So they can look for signs of infection, inflammation, other neurological problems. Yeah, it's a really helpful diagnostic tool.
They tell people to lie flat for a while after they do that.
Right.
Why is that?
It all goes back to that pressure, inside the skull.
Okay.
Even taking a little bit of CSF out can mess with the balance temporarily.
I see.
So laying flat kind of helps keep things stable and prevent complications.
So it's a really carefully balanced system.
Yeah.
What happens when the pressure goes up?
Right. So when ICP rises above the normal range,
Right.
it kind of triggers a chain reaction that can
Yeah.
ultimately damage the brain. It's almost like a traffic jam
Okay.
in your skull. As the pressure goes up,
Right.
it gets harder for blood to flow to the brain tissue,
Right.
which means less oxygen,
Got it.
which the brain cells really need to, do their thing and stay alive.
Yeah. That makes sense. And that's what the guide calls a secondary injury, right?
Exactly.
It's not the initial injury, but the lack of oxygen and increased pressure that causes even more damage.
Yeah, it's like this domino effect
Oh, okay.
where one thing leads to another. And,
Okay.
What's scary is that this secondary injury can develop over hours
Right.
or even days.
So it's important to know the signs.
Yes.
So what are some of the early warning signs that someone might have elevated ICP?
Well, a lot of times it starts really subtly.
Okay.
The person might have a headache, feel nauseous, might even vomit.
Okay.
They might have some vision changes,
I see.
like blurry vision, double vision.
Okay.
Or they might seem confused or
Oh.
drowsy.
Okay. So nothing too alarming.
Yeah, but if things progress, the signs get a bit more serious.
Okay.
Their pupils might be fixed and dilated, which means they don't react to light.
Whoa.
Seizures are another red flag.
Mm.
And then abnormal postures.
Our guide talks about two types of posturing.
Right.
Decorticate and decerebrate.
Yeah.
What is the difference?
Okay, so decorticate posturing is when the person's arms are like bent inwards towards the chest.
Okay.
And then decerebrate is when their arms are extended and rotated outwards. Decerebrate is usually a sign of more serious brain dysfunction.
Okay, so those are definitely not good signs.
No, definitely not.
And then there's this thing called Cushing's triad.
Ah.
So what's that all about?
Cushing's triad is a very, very late sign.
Okay.
It's like the brain's last-ditch effort. Oh.
It basically means that the pressure in the skull is so high
Right.
that it's compressing the brainstem, which controls, all those vital functions.
Right, breathing, heart rate.
Exactly.
So what are the signs of Cushing's triad?
It's a combination of three things.
Okay.
First, their systolic blood pressure goes way up,
Right.
but their heart rate slows down.
Huh. Interesting.
And then their breathing becomes irregular
Wow.
and shallow.
So that's a very serious thing.
Very serious. It often means that brain death is coming soon.
Oh, wow.
So yeah, you definitely want to get help way before.
Right. Recognize those early signs.
Exactly.
The guide also mentions a procedure called a ventriculostomy
Right.
to monitor ICP.
Yes.
Can you explain what that is?
So it's also called an EVD,
Okay.
external ventricular drain.
Okay.
It's a surgery
Okay.
where a catheter is put into the ventricles of the brain.
Right.
Those fluid-filled spaces we were talking about.
And it lets doctors monitor that pressure continuously and drain off extra CSF if needed.
So it's like a release valve.
Yeah, you could think of it like that.
So what's the nurse's role in all of this?
Nurses are super important in caring for patients with EVDs.
Okay.
They're really the eyes and ears at the bedside.
Mm.
They watch those ICP readings.
Right.
They do frequent neuro checks to make sure the brain's working okay. And they make sure the EVD is working right.
So they have to know a lot. Yeah,
they have to have a deep understanding of how the brain works.
Okay, so what about managing elevated ICP? What are some of the things that can be done?
It's kind of a multi-pronged approach.
Okay.
One of the first things we do is elevate the head of the bed. Helps to improve the drainage from the brain.
Okay, interesting.
We also want to keep things nice and calm and quiet.
Right.
Minimize any stimulation that could make the pressure go up.
Right.
We're really careful with fluids. Make sure they're hydrated, but not overloading them.
Got it.
And of course, there are medications.
What kinds of medications are used?
So, diuretics like mannitol help to pull out excess fluid from the brain. Corticosteroids like dexamethasone are really good at reducing brain swelling.
Okay.
And then hypertonic saline, which is a very concentrated salt solution, helps to pull fluid out of the brain tissue.
So all these different approaches work together to bring the pressure down.
Exactly.
Awesome. So let's switch gears a little bit and talk about head injuries.
Sure.
They're pretty common, right?
Yeah. Even seemingly minor bumps can have big consequences.
Wow. And the guide talks about, different types of head injuries.
Right.
Starting with scalp lacerations and skull fractures.
So scalp lacerations are those cuts on the scalp.
Right.
They bleed a lot because there's a ton of blood vessels there.
Okay.
And then skull fractures, they're all sorts of types and severities.
Right.
They can be linear depressed, simple, compound, closed, or open.
So it sounds like any head injury should be taken pretty seriously.
Absolutely. There are some signs that we always look out for.
Right.
Like if someone has bruising around their eyes, it could mean a fracture at the base of the skull.
What is that called?
That's called raccoon eyes.
Raccoon eyes, okay.
Yeah, not cute at all.
No, not at all.
And then there's also bruising behind the ear called Battle's sign.
Battle's sign.
Yeah, those both mean a potential fracture in those bones at the base of the skull.
Got it.
And those can be really serious.
Okay. The guide also mentions something called a halo sign.
Oh, yes.
What is that?
So that's when you see a ring of clear fluid around a spot of blood.
Okay.
And that often means CSF is leaking out.
Oh, wow.
So there's a tear in those membranes that protect the brain and spinal cord.
So that's bad.
Very bad. It increases the risk of infection, which can be devastating.
So the guide also warns against putting in an NG tube. If they think there's a basilar skull fracture.
Yes.
Why is that?
Because the tube could actually go into the brain through the fracture and introduce bacteria and cause a serious infection.
Wow. Okay.
So even routine procedures can be dangerous with a head injury.
Okay, so aside from skull fractures, we've also got concussions and contusions.
Yeah.
What's the difference?
So a concussion is like a mild traumatic brain injury.
Okay.
Think of it as like a temporary disruption in how the brain works.
Okay.
Kind of like a brain bruise.
Okay.
A contusion is more like a focused bruise on the brain where there's actual damage to the brain tissue.
Okay, so more serious.
Yes, generally.
Okay.
Have you ever heard of a coup contra coup injury?
No, what's that?
So picture this, you get hit in the head, right?
Okay.
Your brain's floating in that CSF.
Yeah.
It can actually hit the opposite side of your skull.
Oh, wow.
Causing injuries in both places.
Got it.
The point of impact and the opposite side.
So like a double injury?
Yeah, basically.
And then, talking about severe head injuries, TBI, traumatic brain injury, they use the Glasgow Coma Scale.
Yeah, the GCS.
Right, to classify the severity of it.
Exactly.
So what is the Glasgow Coma Scale?
So it's a standard way to figure out how conscious someone is after a head injury. We look at 3 things.
Right.
Can they open their eyes?
Right.
Can they talk?
Right.
Can they move on purpose?
Got it.
Based on that, we give them a score to see how bad the injury is.
Okay, so the lower the score, the worse it is.
Yeah, a score below 8 usually means coma. And a score below 5 often means we start talking about organ donation.
Wow.
So yeah, it can get really serious.
The guide mentions something called DAI. Diffuse axonal injury.
Yes.
What is that?
So DAI is when the white matter of the brain is damaged.
Okay.
Think of that as the brain's communication network. These injuries mess up connections between different parts of the brain, leading to some pretty severe problems.
But it says that most of those patients,
yeah,
90%,
yeah,
stay in a vegetative state.
Yeah, it's pretty grim.
Yeah. So intracranial hematomas.
Okay.
What are those? Why are they so dangerous?
So a hematoma is just a collection of blood.
Right.
When it happens inside the skull,
Yeah.
it's called an intracranial hematoma.
Got it.
Basically, it's bleeding inside the head,
Right.
which can put a lot of pressure on the brain.
So there are different types, right?
Yeah, there's epidural,
Right.
subdural, and intracerebral.
So where are those located?
So an epidural hematoma happens between the skull and the dura mater.
Right.
That's that tough outer layer of the meninge.
Right, those membranes that protect the brain and spinal cord.
Exactly.
So right under the skull. And what about subdural?
Subdural is under the dura mater, between the dura and the arachnoid mater.
Got it.
Which is another layer of the meninges.
And then intracerebral.
That's in the brain tissue itself.
Oh, okay.
Usually from a ruptured blood vessel.
So are some types more dangerous than others?
Well, they're all pretty bad.
Yeah.
But epidural hematomas are especially concerning.
Okay.
They usually involve arterial bleeding,
Okay.
which is really fast and forceful.
So it's a true emergency.
Yeah, you need to act fast.
What about subdural?
Subdural usually comes from venous bleeding, which is slower.
Okay.
But it can still be very dangerous if not caught early.
And what about intracerebral?
Those, it really depends on the size and where they are in the brain.
Right.
Some are small and don't cause much trouble.
Okay.
Others are large and can be life-threatening.
So what are the treatment options for these hematomas?
It depends on a lot of factors, like what type it is, how big it is, where it is, and the overall health of the patient. But surgery is often needed to take out the hematoma and relieve the pressure.
So what are some of the surgical procedures that they do?
One common one is a craniotomy, where part of the skull is temporarily removed to get to the hematoma.
Okay. And then there's a craniectomy.
Right, where they take out a part of the skull and don't put it back right away.
Wow. Okay. So what are some of the key things that nurses need to do when caring for someone with a head injury?
Nurses play a vital role in monitoring these patients for any signs that things are getting worse neurologically.
Right.
We're constantly checking things like their level of consciousness, their pupil size, how they react to light, their motor strength, and things like that.
So it's all about catching those little changes.
Exactly. We also want to make sure to prevent infection.
Right, especially with open wounds and stuff.
Exactly. And we keep a close eye out for any signs of CSF leaks.
Right, because that can let bacteria in.
Exactly. It's a really demanding and specialized area of nursing care.
It sounds like it. And of course, you have to educate the patients and families too.
For sure.
What are some of the key points to emphasize?
We really stress that they need to avoid anything that could raise the pressure in their skull.
Okay.
Like blowing their nose really hard.
Oh, right.
Straining when they go to the bathroom.
Okay.
Or even coughing too hard.
Wow. Okay.
And we really want to make sure they understand that recovery from a head injury takes time.
Right.
And they need to be patient.
Got it.
And have good support.
Okay. Now, switching gears again, let's talk about brain tumors.
Okay.
Where do they fit into all of this?
Brain tumors, just like the other things we've been talking about, can mess up that balance inside the skull. They can press on the brain tissue, block the flow of CSF, or even invade the healthy tissue.
Okay. And the guide talks about primary and secondary brain tumors.
Right. So primary tumors start in the brain, and secondary or metastatic tumors spread from somewhere else in the body.
And thankfully, not all brain tumors are cancerous.
That's true. There are benign and malignant.
Okay. So what's the difference?
A benign tumor is kind of like a well-behaved house guest.
Okay.
It might take up some space,
Right.
but it doesn't usually cause a ton of trouble.
Okay.
Malignant tumors are more like unwanted intruders. They grow fast, invade nearby tissues, and can even spread to other parts of the body.
So those are the really bad ones.
Yeah, definitely more serious.
And the guide says that the treatment for brain tumors can vary depending on a few things.
Exactly. We look at what type of tumor it is, where it is, how big it is, and the overall health of the patient.
Got it. So what are some of the options?
Sometimes we do surgery to remove the tumor.
Right.
Sometimes we use radiation therapy to target and kill the cancer cells.
Okay.
Sometimes chemotherapy to kill cancer cells throughout the body.
Okay.
Or sometimes a combination of those things.
Got it. What about supportive care?
Oh, yeah, that's super important too.
Right.
Supportive care is all about managing the symptoms,
Right.
improving their quality of life, helping them cope with all the challenges that come with the diagnosis and treatment.
So it's not just about treating the tumor.
Exactly.
But also taking care of the person.
Yeah, we want to address the whole person.
Makes sense.
Yeah.
So let's go back to those inflammatory conditions of the brain.
Okay.
They can be caused by all sorts of things, right?
Yeah, bacteria, viruses, fungi, even parasites.
Wow. Oh.
And figuring out the specific cause is super important for treating it effectively.
So it's like a puzzle.
Kinda, yeah.
And are there certain things that make people more likely to get these infections?
Yeah, like age is a big one.
Right.
Infants and older adults.
Right.
They tend to have weaker immune systems.
Makes sense.
Huh.
What about other medical conditions?
Right, things like diabetes, HIV/AIDS, cancer.
Right.
Those can weaken the immune system too.
Okay.
And then lifestyle things.
Right, like smoking and stuff.
Yeah, smoking, drinking too much, using drugs.
Right.
Those all make it easier to get sick.
So it's important to stay healthy.
Definitely. You know, another important thing is travel history.
Why is travel history important?
Well, if you travel to certain parts of the world, you might be exposed to things that aren't common back home.
Right, right.
So if you get sick after a trip, it's really important to tell your doctor where you've been.
That makes sense. So how do you diagnose these inflammatory conditions?
Well, one of the most important tests is a lumbar puncture.
Right, the spinal tap.
Yeah, the same one we talked about before.
Okay.
But this time we're looking for signs of infection in the CSF.
Got it.
They look at things like the white blood cell count,
Right.
the protein and glucose levels.
Okay.
And they try to grow the bacteria or whatever else is causing it.
Oh, right, to see what it is.
Exactly. And they do blood cultures too, right? Yeah, blood cultures are important to see if the infection has spread to the bloodstream.
Right.
Which is really serious.
Okay, so what are the treatment options?
Well, it really depends.
Okay.
If it's bacteria, we use antibiotics.
Right.
If it's a virus, we use antivirals.
Oh.
But sometimes we have to start treatment even before we know exactly what it is.
Why is that?
Because with some of these things, every minute counts.
Right.
Especially with bacterial meningitis.
Right.
Delays can be really dangerous.
Okay.
So we often start with broad-spectrum antibiotics.
Right, that cover a lot of things.
Exactly, and then we can adjust the treatment.
Right, once you know.
Yeah, once we know exactly what we're dealing with.
And what about supportive care?
Oh, that's really important too.
Right.
We want to manage the symptoms like fever, headache, pain, and make sure they're comfortable.
Okay. And the guide mentions corticosteroids.
Right. Corticosteroids are really good at reducing swelling and inflammation.
Right, but they have side effects.
They do, so we have to be really careful with them and weigh the benefits and the risks.
Got it. So nurses play a key role in all of this, right?
Oh, yeah. Nurses are the front line in these cases.
Yeah.
We're constantly monitoring the patients, managing their pain and fever, giving their medications.
Right. And the guide talks about frequent neurological assessments.
Right. We check things like their level of consciousness, their pupils, their motor strength, any changes in their speech or behavior.
So you have to be super observant.
Yeah, we got to catch those little changes before they become big problems.
Love that.
And then with bacterial meningitis, we got to be really careful about infection control.
Right.
Those patients are really contagious.
Okay.
So we put them in isolation.
What does that mean?
They get a private room with a special ventilation system that filters the air.
Okay.
And we wear gowns and gloves and masks when we go in there, and visitors are usually restricted.
Okay. And what about educating the patients and families? What do you tell them?
We emphasize that they have to finish all their medications.
Okay.
Even if they start feeling better before they're done.
Right, right.
And we also talk about follow-up care.
Okay.
To monitor for any complications or long-term effects.
So they understand the importance of sticking with the plan.
Exactly.
Okay, great. Well, we've covered a lot of ground in this first part of our deep dive.
We have.
We've talked about intracranial pressure, head injuries, hematomas, brain tumors,
Yeah.
and all sorts of inflammatory conditions.
It's a lot to take in.
It is.
But it's all about understanding
Right.
how these things affect the brain.
Right.
And how we can try to prevent and treat them.
Awesome.
It's really amazing how far we've come in terms of treating these conditions.
It is.
But there's still so much to learn. It's
Yeah.
going to be an evolving field.
Definitely. Well, this has been really informative, I think. I've learned a lot.
Good, me too.
So what's next? Where do we go from here?
Well, in the next part, we're going to dive deeper into the different types of brain tumors.
Okay.
Talk more about diagnosing and treating those inflammatory conditions.
Right.
And really focus on the role of nurses in caring for these patients.
Okay. Sounds good.
It's going to be good.
I'm looking forward to it.
Yeah, me too. Welcome back to the deep dive. We're going to keep talking about those acute intracranial problems, really digging deeper into brain tumors and those tricky inflammatory conditions.
Yeah, the brain's a pretty amazing thing, but when it goes wrong, it can really cause problems, right?
Absolutely. And with brain tumors, it's not just figuring out what kind it is.
Yeah.
It's understanding how it's messing with that whole delicate system in there.
Right. So we were talking about benign and malignant brain tumors before.
Right. The non-cancerous ones versus the cancerous ones.
Yeah. So what's the big difference?
Well, think of it this way.
Okay.
A benign tumors, like that house guest who's really well behaved, might be taking up space, but they're not causing a lot of trouble.
Right.
But a malignant tumor, that's like an unwelcome intruder barging in.
Oh, I see.
Growing super fast, invading everything, might even decide to move to a different part of the house.
Right. So the malignant ones are the ones we really got to worry about.
Yeah, definitely more serious.
So the guide says that how we treat brain tumors really varies.
Absolutely.
What are some of the things that affect the treatment plan?
Well, we look at the type of tumor, of course.
Right.
Where it's hanging out in the brain, how big it's gotten.
Right.
And the overall health of the patient.
Right, because everyone's different.
Exactly. So treatment's not like a one-size-fits-all kind of thing.
Okay, so what are the options?
We might do surgery to remove it.
Right.
Maybe radiation therapy to target those cancer cells.
Right, right.
Sometimes chemotherapy to kill cancer cells all over.
Or maybe even a mix of all those things.
Okay. And what about just helping people feel better?
Oh, yeah, supportive care. That's super important.
Right, because it's more than just getting rid of the tumor.
Absolutely. It's about helping them manage symptoms, improve their quality of life, and deal with everything that comes with this diagnosis.
So it's really taking care of the whole person, not just the disease.
Exactly.
So let's go back to those inflammatory conditions we were talking about. Infections in the brain and spinal cord.
Right, right. They can be caused by so many things.
It's crazy, right? Bacteria, viruses, fungi, even parasites, the guide says.
Yeah, it's wild. And figuring out the exact culprit, that's super important for figuring out the best treatment.
So it's like detective work.
Kind of, yeah. We have to piece together clues to figure out what's going on.
Okay. Are there certain things that make people more likely to get these infections?
Absolutely. Age is a big one, like we talked about.
Right. Babies and older people. Exactly. Their immune systems aren't as strong.
Yeah, that makes sense. What about other medical problems?
Yeah, things like diabetes, HIV/AIDS, cancer.
Okay.
Those can weaken the immune system too.
Right. So if your body's already fighting something, it's harder to fight off something new.
Exactly. And then lifestyle choices play a role too.
Right, like smoking.
Yeah, smoking, drinking too much, using drugs.
Right.
Those all make it easier to get sick.
So taking care of yourself is important for preventing those infections.
For sure. Another thing that's important to consider is travel history.
Oh, right. Why is that important?
Because different parts of the world have different bugs,
Oh, okay, yeah.
So you might be exposed to something unusual while traveling.
Right, and then get sick when you come back.
Exactly. So it's super important to tell your doctor.
Right, if you've been traveling.
Yeah, if you've been anywhere unusual and then start feeling sick.
That makes sense. So once you think someone might have one of these infections, how do you figure out what it is?
Well, one of the most important tests is a lumbar puncture.
Right, the spinal tap.
Yep, same one we talked about earlier.
Okay.
But this time, we're using it to look for infection in the CSF.
Got it. So you can use the same test for different things.
Exactly. They'll check the white blood cell count,
Okay.
see if it's higher than normal, which usually happens with infection.
Right. And they also look at protein and glucose levels, right?
Yep. Those can be off in certain infections too.
Okay.
And then they try to grow the bacteria or whatever's causing the infection.
Right. So they can see what it is under a microscope.
Exactly. And sometimes they do blood cultures too.
Why they do that?
To see if the infections spread to the blood.
Oh,
that's called sepsis, and it can be really dangerous.
So it's a way to see how serious the infection is.
Exactly. And sometimes they do CT scans or MRI scans too to rule out other things.
Right.
Or see how much the brain's involved.
So a lot of different tests to get the whole picture.
Right. Once we know what we're dealing with, then we can start treatment.
So what are the treatment options?
Well, for bacterial infections, we use antibiotics.
Right.
For viral infections, we use antivirals.
Okay. And the guide said sometimes you have to start treatment before you even know what it is.
Yeah, that's right. With some of these infections, especially bacterial meningitis, time is of the essence.
Right. You can't wait.
Exactly. Delays can be really dangerous.
Wow. So you just start with something that covers a lot of different things.
Right. Broad spectrum antibiotic.
Okay. And then adjust it later.
Yeah. Once we know the exact culprit from the tests.
And supportive care is important too.
Oh, yeah. Super important.
Okay. Yeah. So controlling fever, pain.
Exactly. Keeping them comfortable.
The guide mentioned corticosteroids.
Right. Those can be really helpful.
Okay.
For reducing swelling and inflammation.
But they can have side effects.
Yep. So we have to be careful, weigh the risks and benefits for each patient.
Okay. So nurses are super important in all this, right?
Oh, absolutely. Nurses are the heroes in these situations. We're the ones constantly watching the patients, managing their symptoms, giving their meds.
And the guide talked about those frequent neurological assessments.
Right.
What exactly are you looking for during those?
So many things. Level of consciousness, pupil size and reactivity, motor strength.
Okay.
Any changes in how they're talking or acting.
So you really have to pay attention to the little details.
Absolutely. Any changes could mean something's getting worse.
Right.
Yeah.
And infection control is super important too, right?
Oh, yeah. Especially with bacterial meningitis.
Okay.
Those patients are really contagious.
Right.
So we have to put them in isolation.
So what does that mean? They're in a special room or something?
Yep. A private room with a special ventilation system.
Right.
To filter the air.
Okay.
And we have to wear gowns, gloves, masks when we go in.
Wow. Okay.
And visitors are usually limited.
So it's a really controlled environment.
Exactly. We're trying to prevent the spread of infection as much as possible.
Makes sense. And you have to educate the patient and family too, right?
Absolutely. It's super important for them to understand what's going on.
Right. So what are some of the key things you tell them?
We stress how important it is to finish all the meds.
Okay.
Even if they start feeling better before they're done.
Right. Because it could come back.
Exactly. We also talk about follow-up care.
Okay. So they know what to expect.
Yeah, so they know what to watch for and what to do if anything changes.
Okay, that's great. So are there long-term effects from these infections?
Unfortunately, yes. Some people might have problems even after the infection's gone.
Oh, no. What kind of problems?
It really depends on how bad the infection was and what parts of the brain were affected.
Right.
Some people have trouble thinking clearly.
Okay.
Problems with memory, concentrating, making decisions.
Right.
Some people have seizures, weakness, even paralysis. And sometimes they have personality changes or changes in how they act.
So these infections can have a big impact on people's lives.
Definitely. They can affect every part of their life.
So it's really important to catch them early?
Absolutely. Early diagnosis and treatment are crucial.
Okay.
And then rehab can help them get back as much function as possible.
So it's a team effort?
Oh, absolutely. It takes a village.
Right. So doctors, nurses, pharmacists, physical therapists, everyone working together.
Exactly. It's like an orchestra.
Oh, I like that.
Everyone playing their part to create something beautiful.
And the guide says that good communication is key.
Oh, yeah. Communication is everything.
Right.
We all need to be on the same page to make sure the patient's getting the best possible care.
Makes sense. Well, this has been a really interesting discussion.
It has. I always love talking about the brain.
Me too.
It's just so fascinating.
It really is. So what's next in our deep dive?
Well, in the next part, we're going to really focus on brain tumors. The different types, how we diagnose them, how we treat them.
Sounds good.
It's going to be fascinating.
Okay, great. Welcome back to the deep dive. This is the final part of our look at acute intracranial problems. It's been a really informative journey so far.
It has been. We've gone through so much.
Yeah. Learn about ICP, head injuries,
Yeah.
brain tumors, infections.
The brain is a delicate thing, but it's also incredibly resilient.
It is.
Yeah.
And even though we've been talking about some pretty serious stuff,
Right.
there is hope.
Right. Absolutely. Medical science is always advancing.
Right. And the guide really emphasizes that the sooner you catch these problems,
Yeah.
the better the outcome.
Exactly. It's like imagine a fire.
Okay.
The faster you put it out, the less damage it does.
Yeah, right.
Same idea with these brain problems.
So knowing the warning signs
Yeah.
and getting help quickly, that's really important.
Absolutely. And the good news is many of these things are treatable.
Okay, that's good to know.
Okay.
Now, you were talking about secondary injury before.
Right. That's when the initial injury kind of sets off a chain reaction.
Yeah. It's kind of scary to think that the first injury isn't the whole story.
It is. But it's important to understand because it helps us focus on preventing further damage, giving the brain the best chance to heal.
And the guide says this secondary injury can happen a while after the first one, right?
Yeah, sometimes hours, sometimes even days later.
Wow.
That's why we have to be really vigilant, watching for any changes.
Okay. So what are some of the things that cause this secondary injury?
Well, increased ICP is a big one.
Right, because that pressure cuts off blood flow.
Exactly. Remember that rigid container?
Yeah.
If the pressure gets too high, the blood can't get to the brain.
Right, and the brain needs oxygen to survive.
Exactly. And then there's inflammation,
Yeah.
which is the body's natural response to injury. But
Yeah.
too much inflammation in the brain can actually make things worse.
So it's a delicate balance.
It is. We need some inflammation to heal, but not too much.
Okay. And what are some of the things they do to address secondary injury?
Well, it depends on the situation.
Right.
Sometimes medications, sometimes surgery, sometimes supportive care measures.
Right, like we've been talking about.
Exactly. And it's often a combination of approaches.
Right, because everyone's different.
Exactly. Each person needs a tailored plan.
That makes sense. So what's next for treating brain injuries? Are there any exciting new developments coming up?
Oh, definitely. There's a ton of research going on.
Okay, like what?
Well, there's stem cell transplantation, for example.
Wow, okay.
And new drugs that can protect brain cells from damage.
Interesting.
They're even working on better ways to diagnose brain injuries early on.
So it's a really exciting time for this field.
It is. The more we learn about the brain, the more we can do to help people.
Now, before we finish up,
Yeah.
I want to leave our listeners with something to think about.
Okay.
We've learned a lot about how fragile the brain can be,
Right.
but also how strong it is. So what can we do every day to protect our brains and keep them healthy?
That's a great question. Well, first off, the obvious stuff.
Okay, like wearing a helmet.
Yeah, wearing a helmet when you're biking, skateboarding, anything like that.
Right.
Always wearing your seatbelt in the car.
Right, being careful not to fall.
Exactly. But it goes beyond just physical safety, you know?
Okay.
Eating healthy foods,
Right,
getting enough sleep, managing stress.
right. Those are all important,
They really are. And doing things that challenge your brain, you know?
like puzzles and stuff.
Yeah, puzzles, reading, learning new things,
Right.
keeping your brain active and engaged.
So it's all about taking care of your whole self.
Exactly. It's all connected.
Well, that's a great takeaway. It's been awesome exploring all this with you today.
It's been fun.
Yeah, I learned a lot.
Me too.
Thanks for joining us on the Deep Dive, everyone. Keep those brains healthy and keep learning.